just let us know if you can hear us and see us. If you just type in the chat box, yes, we're good to go, that would be great. Yes. Oh, we got some yeses. All right, perfect. All right, well, we'll get started. So I'm Chloe Storm. I'm an admission counselor here at Xavier, and co-hosting with me tonight is my wonderful colleague, Lindsay Steller.
Hello, everyone.
All right. And tonight we are joined by Jean Griffin and Dr. Cleves from Tri-Health. Jean's the Dean of Students. So I will take it over to them and let them kind of explain their roles here as well.
Great.
So Jean, you want to
Sure.
take it away?
Yeah, I'll start. So welcome, everybody. We're glad that you're tuning in with us tonight. My name is Jean Griffin. I'm the Dean of Students here at Xavier, and one of the areas I oversee is our student health services, which we have some exciting changes that we want to share with you tonight. And I'll let Dr. Cleves introduce himself.
Hi, I'm Steve Cleves. I'm a physician, and although the relationship with Xavier and Tri-Health is new, I'm actually a Xavier grad, and I've been in health and wellness here at Xavier for 25 years as a physician taking care of students on campus.
Excellent. So do we have our PowerPoint?
All right, well, yeah, we'll get started
We have
here.
a PowerPoint that Dr. Cleves and I will talk through. We definitely will have some time for questions at the end. Can people try and type in questions, Chloe, or?
Yes,
so
you can.
type in questions and we'll make sure we get to all of those.
Just scroll up and go to on your actual PowerPoint and then do like you're given F5. Yeah.
So for tonight's agenda, we really just want to share with you this exciting partnership that Xavier has entered in with Tri-Health, and then and get into some specifics of how that's really going to operate on campus and the really exciting opportunities that will present to Xavier students. That includes you. So I can first, what we want to make sure we accomplish, I got it, there we go, is talk about the mission and values that Xavier and Tri-Health share, and then do a little overview of what the partnership is going to look like. And then we'll dig in and get into student health services. What kinds of services are we going to provide? We want to talk with you a little bit about our student health insurance plan and some considerations regarding that. And then we'll talk a little bit also about our counseling services and psychological services, things to help support students' mental health and well-being. And we'll answer your questions. So the first thing I think that's really important to say is that Xavier has had an ongoing Tri-Health partnership with Tri-Health for many years. As Dr. Cleves mentioned, he's been around with us for a while. Tri-Health has been working with our student athlete program for a long time. But this past semester, we really kind of doubled down on that partnership to develop what will be a long-term partnership between the university and Tri-Health that's really going to enhance our community's well-being. This partnership works so well because Tri-Health and Xavier really have very similar missions. You've probably heard Xavier talk about our cura personalis, our care for the whole person. We really think to educate our students, we want to educate them holistically, and that means taking care of their physical and mental health as well as their academic performance. Tri-Health has a similar mission to really care for people holistically and improve the health status of all the people that they serve. And so there's this really nice common ground between Xavier and Tri-Health where we can together become really experts in collegiate healthcare that is focused on improving students' minds, bodies, and spirits. So it's a partnership that comes from this really shared vision and shared mission. And I'll let Steve talk a little bit about the overview of that partnership and what that's going to look like.
Thanks, Jean. As Jean said, it really is the combination of two entities that have their own area of expertise. Xavier, of course, as an educational institution, is all about the education, about the development of the student to allow them to become, the person that they are meant to be. And on the Tri-Health side, Tri-Health is all about health and wellness and well-being. So, as I said before, I've been around here for a very long time. And when I started working here many, many years ago, the Student Health Center was actually a dorm room in Coolman Hall. And we have obviously improved the facility to where we are now on Clinet. And as we move forward with the relationship between Tri-Health and Xavier, we will have what we really consider to be a state-of-the-art center here on campus, where we can combine all of the various aspects of health, wellness, recreation, education. And it really will be a state-of-the-art facility. There should be very soon available some schematics and some drawings to really begin to show everyone the energy and effort behind this product. Inside the walls of that new state-of-the-art facility, we will be providing exquisite health care, not only on the primary care side, which is my area of specialty, but sports medicine, physical therapy, counseling, wellness, a very comprehensive plan for both the primary care needs of the student as well as specialty care.
And recreation, I think that's a really exciting piece of it. You're going to have, in your time here at Xavier, you're going to have a state-of-the-art rec center with all of the newest equipment
Absolutely.
and opportunities to engage in group fitness and other kinds of personal training and that sort of thing. And we're really at the beginning phases right now of designing all that, but there's so much excitement and energy, and you're going to get to participate in that. So that's pretty exciting.
My son is actually a senior to be here, and he's quite upset that he will not be around for when the hub is finished. So
I know. I wish, you know,
Yeah,
as they were going, I wish I.
But I told him he can't stay for 3 more years because
Right.
that's just not on the plan. So.
The other cool thing about this partnership, I think, is for those of you who may be considering a major that has a clinical component. So maybe you're thinking you might like to be a nursing major or an OT major. There's going to be opportunities, enhanced opportunities with TriHealth that might even take place right on campus in the hub for you to get that clinical experience with some of the leaders in our community in those fields. So that's a pretty exciting opportunity that this partnership between Xavier and TriHealth will bring as well.
On the educational side, TriHealth has multiple residency programs in internal medicine, family practice, surgery, and obstetrics and gynecology. So students who are interested in a pre-med major will have a wealth of opportunities to get more hands-on experience than they would have had or than they currently have here on campus now. So we will be rotating specialty care through the university, and an opportunity to do some shadowing, to do some hands-on experiential treatment will be something we'll be able to offer the students in the future. It's a very exciting time, actually.
So you want to talk a little bit more about student health services?
Absolutely.
All right.
Thank you.
Yeah.
So the way student health will be provided at Xavier is the staff, the faculty on campus, effective actually July the 1st, will be TriHealth employees. So TriHealth and Xavier have developed this partnership, and my staff on campus will actually be under the TriHealth umbrella. We will continue to offer services currently on site at the McGrath Health and Wellness Center, which is just up the street from the Cintas Center on Clinet. And probably the big difference is that there will be billing to the students' health insurance for services on campus. So just like when you go to your doctor now, you know, a primary care visit, there's typically a copay with most insurances, and our cost will align very closely with what you are currently experiencing when you go to see your family doctor or the pediatrician or wherever you receive care. So that copay we will be collecting, you know, on site at the time of visit. We will be accepting the all card, which makes it very convenient for the student to be able to, you know, swipe their all card for the payment, and then any other billing, we will bill your insurance and follow up with that in terms of what payments are required. So it really is a little different than what we've done here before at Xavier, but it's very much what you currently are doing when you go to see your physician at home. We have made a very strong commitment to providing as many services at the time that the service is required, meaning we are going to work very hard to take walk-ins. We will encourage students to make appointments. We are beta testing right now an app where you can actually pull up the schedule on your phone and see what times are available to be seen and schedule around your classes or around whatever else you need to schedule around. And then if you have some requirement for ongoing care or for follow-up, our providers will be there on a set schedule. For example, I will be there every Friday. So if a student sees me and we feel like follow-up with me is an important thing, we'll reschedule for the next week or at whatever interval is required for follow-up. So we're really going to promote great accessibility for the student to be seen, but also continuity of care where they can follow up with their individual provider as needed on a regular basis. So we're going to try to give everyone the best of both worlds. You know, immediate access when necessary and longitudinal follow-up care with their provider of choice. It's going to be a new world for all of us. So I'm sure we'll have some bugs along the way. But as I said, having been here for a long time and having been in private practice for a long time, this will mirror very, very carefully, very, very closely what you've always experienced, you know, at home with your family provider.
So I think I can't state it enough and echo it enough. Students will need to bring their health insurance cards with them to receive care on campus. And we're going to talk with you a little bit more about some of the options, or the option that we provide, and give you some things to think about in terms of what kind of insurance do you want to have with you and available to use here on campus. Is it your family insurance? Might you want to purchase Xavier's insurance? We'll talk more about that, but really important. And you'll see some pictures coming out soon of the blue blob carrying an insurance card, because we really want to send this message. Bring that insurance card with you when you come to campus in August.
And Jean may be mentioning this, down the road in our presentation, but if for whatever reason you don't have your card, or for whatever things you're worried about payment, we are never going to turn a student away. So, my job is to provide excellent care on campus, on site, when the student needs that care. The financial piece is an important piece, but it will never preclude a student receiving care at McGrath Health and Wellness.
I'm glad you said that too, because I think that shows the commitment that
Absolutely.
we share, that this is a mission-driven decision, and our primary focus is to take care of our students. And so that's
Absolutely.
one way that we've committed to doing that, and TriHealth has been great since day one about ensuring that. Yeah, great.
You.
So we're going to talk a little more specifically, Steve will, about the primary care services that will be provided at McGrath.
Sure. So think about what happens now when you go to see your family doctor at home. You could be sick. You could be following up for chronic diseases. You could be going in for your sports physical, or just your routine once-a-year visit. All of those services will be provided on site. So in terms of diagnosis and treatment of illnesses, it will be the full complement of services that would typically be available at a primary care doctor's office. We'll draw blood work. We'll do strep tests. We'll do mono tests. We can do urinalysis. We treat anything and everything that walks through the door. So we are all board certified primary care providers, and this is an extension, I think, of my own office, which one of my offices is actually here on campus in Xavier, which we'll talk about in just a moment. So anything that you traditionally have done at your family doctor's office or your pediatrician's office for your child, we will be able to provide that same, robust level of services. We will have an opportunity for a slightly broader expansion because of our TriHealth relationship. We will be able to do some more nutritional counseling, some other wellness things. And as I mentioned, at my office, which is about 300 yards up the street from health and wellness, X-ray is available, OB-GYN is available, GI doctors, and orthopedics. And if there's ever a time where, for whatever reason, staffing, flu season, where things are just too busy at McGrath, again, 300 yards up the street is my office, and we are there Monday through Friday, and we will see any overflow students that need to be seen. Same phenomenon, insurance card copay, it's all in the same family. So my office and the McGrath office are basically twins of each other. We will provide services wherever the student needs to receive those services. So it should be a pretty neat relationship. We're excited.
So we recognize that some students and families have some special topics that they have questions about. We've highlighted 3 that we think, two real significant ones that Steve will talk a little bit about, and then we'll be happy to answer questions if there's something we didn't cover that's a special topic people are interested in.
Absolutely. Thanks, Jean. So allergy shots obviously are a mainstay for a student or a patient who has ongoing allergy issues. And I've seen people, when they're 65, 70 years old, develop allergies somewhat out of the blue. Like, where did this come from? But obviously, a change in environment, coming from some other part of the country, maintaining and controlling those allergy symptoms are critically important. So we are certainly prepared to administer your allergy injections if you've been someone who's been getting allergy shots. The only requirement we really have is that you're on a stable dose. And that's really to protect the student. I mean, it's inconvenient to say, okay, if there's a change of dose, we're going to ship you off, to an allergist office. I have a very strong relationship with several allergists here in town, one of whom is, less than a mile and a half away from Xavier's campus. But it's really for the student's protection. A change in allergy dosing is a critical time when an allergy shot is being administered. And if it's too strong, there is the possibility of an allergic reaction. And we want that student to be in the appropriate setting if, God forbid, something like that should happen. So we are quite comfortable administering allergy shots when it's a stable dose. If there's a requirement for a dosage adjustment, we will work carefully with the student's allergist and with our allergy specialist here in town to make sure that the right medication is administered at the right place and at the right time. So there is a requirement that allergy shots have to be delivered directly to us. We cannot have the student bring that in. And to be quite honest, it's a liability perspective. There's no way to ensure that it was stored properly and maintained at the appropriate temperature if it's not delivered, to us, by overnight delivery. We will keep the allergy medication on site at McGrath, administer the medication as needed. The next topic is another one that is a quite popular topic, and that's the ADHD medication. And I have a son who is on ADHD medication, so I understand the importance of this. And we are happy to provide that service. I simply need to have, the appropriate history, the appropriate treatment plan, and, testing that shows that the patient does meet the criteria for requiring ADHD medication. We are happy to provide that. And in fact, which may be something new to a lot of you from a parent's perspective, I now have the ability here in Cincinnati to send the ADHD prescription directly to the pharmacy. So therefore, you don't have to worry about the student losing the prescription or getting lost in translation. The pharmacist doesn't understand what we want. There's a delay in filling. So we actually, through TriHealth's technology, can send the prescription directly to the pharmacy for the student to pick up at his or her convenience. So that's actually a very new phenomenon and really makes the whole needing the prescription and the timeliness much better for us. So we are happy to do that. We just ask you guys to send us a little bit of documentation so there's no gap in being able to prescribe that prescription. The third bullet on the screen is actually, for any other controlled substances. These are medications which would fall under the realm of, the FDA and the DEA for requiring a little closer observation. This could be pain medication. This could be anxiety medication. And I'm assuming that if your child is on one of those, that they're on that and that there is obviously some special needs that we have to fulfill in order to be able to prescribe that medication. So think of an anxiety medication or a controlled substance where your provider at home is required a paper prescription, kind of falling into the same realm as the ADHD. I'm going to need some notes from the prescribing physician. I'm going to need a little bit of history about why the student is on those medications. But this is something we've done forever here at Xavier. We will continue to provide that service. I just need your help, parents, to give me the little bit of documentation that I need so your child can continue to get their medication at the right time.
Great. Okay.
Super.
So we're going to switch gears a little bit and talk more about health insurance. So as we've said, and we'll continue to remind people, you need health insurance to receive care at McGrath. All undergraduate, all students at Xavier are required to have health insurance, and we provide a plan that is an option for students to consider purchasing. If you have looked at your Bursar account this week, you may have noticed that you've already been billed for that plan. So we have our student health insurance plan is a waive off option plan. All undergrad students, 12 credit hours or higher, and most international students are automatically billed for that plan. You don't have to use that plan. And if you are coming with your family's plan, you're covered on mom and dad's insurance, that could be just fine. But I definitely encourage you to look at your plan that you're currently on. Go to our website. You can see it at the bottom here. It's SHIP, which stands for Student Health Insurance Plan. And look at the coverage that's being provided by the Xavier plan, and look at your plan to determine if we're in network for you. There's a list on the McGrath website that tells you all the insurance providers that TriHealth works with. And there's some contact information there, people you can call, so you can really clarify what will the costs be for your student or for you as a student to receive care here on campus through your current insurance. And is it a cost savings if you were to, instead of using that insurance, enroll in Xavier's student health insurance plan? It may be, because our student health insurance plan will be in network if you receive care on campus or at Dr. Cleve's office up at U Station. So definitely something that for this year in particular, families and students are encouraged to pay attention to. What's the plan coming in? What's the option that we're offering? And if you want to enroll in the plan, if you determine that it is financially advisable for you to enroll in Xavier's plan, you can do that effective today. There is if you follow that link, it'll take you to a couple clicks where there'll be some information for you, and you can choose to enroll in Xavier's Student Health Insurance Plan. That is also the same place that you will go if you do not want Xavier's plan. If you don't wish to purchase Xavier's plan, if you're satisfied that the plan that you or your child is bringing to campus, you must waive Xavier's plan in order to not be charged for it. And there is a deadline on that. You see it in red on the screen, and we're going to send you lots of reminders about this. The deadline to waive the Xavier Student Health Insurance Plan is September 22nd. After that point, if you've not waived, you will be responsible for that cost. So we don't want anybody to pay for an insurance plan that they don't want or need. So really important in this time, the next couple months before you come to campus, to consider those options, make a decision, call us and ask us questions if you have them, so that you have exactly what you want and need to receive care on campus.
The other big component to keep in mind is, again, on the screen on the fourth bullet point down, is in-network. So, you know, a robust plan in California is probably considered out-of-network here. So the in-network cost and the out-of-network cost, unfortunately, can be dramatically different. I do know that some families have actually gone on and, if they're out of town or out of state, tried to see if my name was available to put down as their primary care provider for while they're here on campus. And in some cases, that has changed the out-of-network cost to an in-network cost. So that might be worth a little effort on your part, especially if you feel like, you know, there's a chance that your student has, you know, some ongoing medical issues and would need to be seen, you know, on a regular basis. I do want to add that if there is an occurrence where the student has to leave campus for care, as long as they stay in the Tri-Health network, if they're in network on campus at Xavier, they will be in network at Tri-Health as well. So Tri-Health has 5 hospitals and, you know, 200 different office sites around town for specialty care, for urgent care, for other services available. So if they're in network at McGrath, they will be in network anywhere in the Tri-Health system. And last piece of that is, if they do get admitted to the hospital, I actually am an old-fashioned enough doctor that I actually round every day at the hospital. So I see Xavier students if they need to be admitted. You know, they're part of my Xavier family. I'm part of the Tri-Health family. And again, this relationship ties all those things together. So they will not be alone in a strange place. Xavier will be there with them through every step of that journey. Hopefully it's not necessary.
That's awesome. Yeah. I'll definitely be happy to answer more questions about student health insurance. If you have them, you can type them in or let us know at the end. But I'm going to move on at this point and talk a little bit about our counseling services and mental health care that's provided on campus. If our current setup is such that both health services and counseling services are operated out of McGrath Health and Wellness Center on Clannay. That will not change. So counseling will still be located at McGrath and will remain operated by Xavier. So the only difference is some of the new folks coming from Tri-Health in that facility. They will continue to work closely together because we know often physical health and mental health are connected, and there needs to be conversation between the two sides of the house. There will be no insurance billing for counseling services. So there is no charge for counseling services on campus, and we certainly encourage students to utilize these resources. College can be a stressful time. There's lots of transition, and we have some incredible clinical professionals up there who are experts in dealing with the kinds of issues college students might be experiencing. So we certainly encourage students to take advantage of those resources. We're really lucky here at Xavier. We have 2 counseling centers, basically. We have the McGrath Health and Wellness Center that I'm mentioning, counseling services on Clannay. We also have Psychological Services Center, which is a clinic that is associated with our psychology doctoral program, and that's at Sycamore House on campus. So there's a couple different options for students who want to have access to free, confidential counseling by professionals here on campus. We do have on-call counselors available 24/7, so if there is some sort of a need after hours. It's really easy to get a hold of the on-call counselor. And our counselors are working to do all kinds of new treatments and opportunities for students to engage, such as group sessions. They're looking into telehealth. They really want to do what they can to meet students' needs. And there's a number of us that work closely on campus in teams to support students with the kinds of common issues that we see, such as stress and homesickness, sometimes loss of a relationship, a breakup, anxiety and depression are all things that we see pretty regularly, and are eager and happy to help students get connected to the services that will help them with those issues.
And Jean, even though they're separate entities, at least from a technical perspective, the counseling side, which is Xavier, and the medical side, which is TriHealth, works very, very closely together. Because this relationship is grown and changed, my relationship with the counselors has not changed at all. So we are available for medications if necessary. We have a staff psychiatrist who rotates through McGrath for more challenging situations. So that interrelationship between the counseling side and the medical side has always been robust, and it will continue to be so.
Right. Great. So our next bit here, and then I think we're ready for your questions, is just to give you some to-do items. You've got some homework. You're going to be seeing soon, and I don't think I have the exact date, but pretty soon you're going to see on the road to Xavier some new information pop up around wellness and things that you can take care of and that you need to take care of before you arrive in August. One of those is to enter your immunization information. What you're going to see on the road to Xavier is a web-based form where you can type in the dates of the immunizations that you're required to have, and then it will allow you to upload the supporting documentation for those immunizations. So that's something that you're going to want to do this summer while you're home, while you've got easy access to those pediatrician records, and get that in. We do ultimately we remind students all through the beginning of the fall semester, but ultimately, if a student doesn't send us their immunization information, we do put holds on student accounts that could get in your way of registering for spring semester. So it's something that's really smart to take care of this summer and just knock that out of the way. The next thing is, again, back to the student health insurance. You're going to find some information on the road to Xavier that will link you to the information that I've mentioned already on student health insurance. And I really encourage you to spend a little time looking at what we're offering, looking at your current plan, and then make a decision. Do you want to enroll or do you want to waive? And if you want to waive, please do that by September 22nd. I think that's all. Do you have anything to add,
No,
Steve?
I think we're good, Jean. Thank you.
So we'll get started on the question and
Sure.
answer. All right, so if anyone has any questions during this time, you can go ahead and type them in the chat box, but we'll go ahead and get started with the first question. So the first question is, do you provide urgent care if someone is injured? For example, sprained ankle or cut requiring sutures?
Yes, we absolutely do. We have the ability to do any kind of sprain. We have crutches if necessary, and we will suture minor lacerations. So absolutely, we are equipped to do that.
But so that's during 8:30 to.
That's during our regular business hours at McGrath, correct. If it's after hours, there will be a nurse available for phone calls. She could tell you based on the story whether she thinks that's something that would require a more immediate treatment. She will give out medical advice. She will also be able to schedule you for an appointment the next day at Health and Wellness if you want to just come in the next day. So there will be a nurse available after hours, 24 hours after the office is closed, to answer questions and give students advice as to whether they should seek care more quickly or whether it's fine to wait until McGrath opens the next day.
Great. Our next question is, just to clarify, we go to that xavier.edu/ship in order to waive the insurance as well as to opt into the insurance.
That's exactly right. The SHIP website will actually take you out to our insurance broker's webpage, but that's an easy way to remember. Go to the SHIP website and then follow the links, and you can both enroll and waive on the same site.
And if we waive the insurance, do we need to prove that we have our own insurance?
Yes.
Okay.
Yeah. That process will take place online. You can provide documentation to demonstrate that you have insurance, and then you're good to go.
Great.
So the next question is the Xavier insurance plan a 12-month plan?
Yes, it is. The plan dates run August to August.
All right. Do you provide dermatology treatments?
Currently, we do not. We simply don't have the room. When the hub is finished, when our new facility is completed, we will have space to provide more specialty services on campus. Dermatology is a specialty that we can certainly assist with a referral, but currently that would be provided off-site.
All right. If we waive the insurance initially, but have a change during the school year, say during open enrollment, can we opt in later into the program?
I think technically the answer is no. If there is a significant life event, I think we can look into that. But I think for the purposes of this program, we're looking at that September 22nd as the cutoff date. Now, if you have a situation that comes up and you want to look into that, share your specific circumstances with us, there are some staff at McGrath. Mary Beth Sullivan is the person that I'm going to refer you to speak with, who's really the expert on our plan and how that all works. So we could definitely talk more with you about that, but generally speaking, enrollment and waivers need to be done by September 22nd.
All right. So the next question is there a pharmacy drug plan or RX drug plan option included in the coverage that provides good coverage?
There is a prescription plan included in the coverage. I don't have the specific details with me on what the coverage rates are. I think it's pretty comparable for a student health insurance plan. You might have a better plan if it's your mom or dad's or family employer plan. Again, that's a great thing to go and look at the facts. What is the Xavier plan? What's your family plan offering?
And Gene, I do want to add that if it's a student that's seen for an acute sick visit at McGrath, we actually do have a very limited pharmacy available on site for an antibiotic or an antihistamine or a decongestant. So those frequently prescribed medications that we commonly use for students when they are ill, we actually will have available at a very, very reasonable cost, available on site at McGrath.
All right. So is that list of insurance companies that's on that SHIP website as well? So
It
we can
is.
find our...
Yeah, it is.
Okay.
We uploaded it earlier today.
Right. When is the new health and wellness facility expected to be complete, and will it be on campus?
Yes, it's going to be right on campus in between the University Commons apartments, which are across from the Cintas Center, in between the Commons apartments and University Station. There's a big open field right now that is going to be home to what we're calling the hub. Open date is fall of
19, right?
Yeah, so really not that far away.
If you're watching this as the parent or as a incoming freshman, it'll be open the start of your junior year.
Okay, so if I already uploaded or faxed my immunization history last month, would you still like me to upload anything else, or do I need to upload it onto the road to Xavier?
If you've uploaded it already and sent it to Xavier, I think we should be good.
If they faxed it.
We're taking them by fax
Okay,
as well.
perfect.
So I think you're fine. No need to do that twice.
Let's see. I assume that you guys treat asthma issues as well.
Absolutely, we do. We have a nebulizer in the office for acute treatments, and we're all quite comfortable dealing with asthma attacks. That is not something you need to go off campus for.
Where do we need to send the documentation for things like ADHD diagnosis, and when does that need to happen?
The information can be sent to McGrath, and we are fine if you are comfortable faxing that information to us. And I would need to receive that information prior to the student needing a refill on their prescription medication. You need to be able to review the history before we can prescribe the medication.
Where can you upload the medical history and immunization forms?
That's going to be through the Road to Xavier. So that may not have been activated yet, that part of Road to Xavier.
And you guys should be able to expect to see that starting in July.
Okay.
That's
Thanks,
when it
Chloe.
should be available.
Let's see what else we have on here. If students will have it through the calendar year, but not the school year, can they join the medical plan starting in January?
Students can join the plan in January only if they are a first-time enrollee in January.
Okay.
So if you enroll in classes in the fall, you're not eligible to enroll in health insurance in January. But if you're a new student to Xavier in January, that option is available to you.
So the next question is, hi, my son is on a family medical plan that runs through the calendar year. He has contributed to his deductible for 2017, which we would not want to lose. Can he join the medical plan January 1st, 2018?
I don't think that that's an option because the plan is a full calendar year plan and it goes by date of enrollment. So students who enroll in the fall need to enroll in the plan in the fall. That enrollment in January is available for students who are new enrollees to Xavier. Again, if there's a significant circumstance that you want to talk through with us in a more direct kind of one-on-one situation, we can do that. And I would refer you to Mary Beth Sullivan in our McGrath Health and Wellness Center, and you'll find her name on the SHIP site and her contact information to talk more about the specifics of your circumstances. But generally speaking, enrollment has to happen this fall.
They're curious. They want to know what hospitals you do rounds in.
Good Samaritan Hospital, which is in Clifton. It's about a 5-minute drive from the Xavier campus to Good Sam. And as I said earlier, I've been at Good Samaritan for a very long time, and I feel quite comfortable that if for whatever reason a student goes there, they get excellent care, and I am there literally every day.
All right. So if anyone else has any last-minute questions, go ahead and type those in now. We'll get them answered. But I think you guys have answered most of the questions so far.
I just had one come in.
Does health plan cover students who study abroad?
Yes, it does. And again, there's some specific information. You can go to the broker that we use for our insurance plan is Academic Health Plans, and their website is where you're actually going to be enrolling and waiving, and there's specific information on the plan about coverage for study abroad.
All right. And then what ER do you typically send people to?
That would be Good Samaritan as well. Now, remember, our goal is not to have to send anybody to the emergency room. We want you to call the after-hours number first to make sure it's necessary. But if it is, it would be Good Samaritan again in Clifton, about a 5-minute drive from here. Okay.
All right. Any last-minute questions before we wrap things up?
Do you give stickers or lollipops at your
We do
appointment?
not, but if there's a high demand, I'm sure we can come up with that, okay?
No one asked that. That was just
That was just
That was
you.
purely,
Good
you were just
question.
wondering.
If you want a
Just
sticker,
question.
we'll get you a sticker.
We should get you some Xavier stickers.
Absolutely.
That's
You can get Xavier stickers and blue lollipops.
right.
All right.
Awesome.
Well, if
Thanks,
no one else has
everybody.
any questions, thank you, Jean. Thank you, Dr. Cleese,
Thank you.
for joining us tonight. You all can see a copy of this chat on the road to Xavier, so we will send that out. Going forward, if anyone has any questions, please email your admission counselor and we'll get you connected to the right person. So if you have any additional questions after tonight, just go ahead and email your counselor.
Thanks,
All right.
all.
Thanks,
Thank you.
everybody.
Enjoy your coming.